Autistic spectrum disorder. It's not a disability, it's a different ability. Stuart Duncan. What is autism? Autism is a condition that affects social interactions, communication and interest. It affects 1 in 100 people in the UK, and more boys than girls are diagnosed. Symptoms of ASD can be present before the age of 3, but many doctors don't like to diagnose it that early. Causes of autistic spectrum disorder. There are no known causes of ASD. Some believe that it could be a result of genetics and it runs in families. However, no gene has been identified to specify autism. Some doctors think that being premature could affect the outcome of autism. Causes continued. There are many different beliefs on possible causes of autism. Some families and doctors believe that the MMR vaccine could cause autism. This is due to the mercury in some vaccines, but this is not true. This is because at the same age children are getting these MMR vaccines, they are diagnosed with ASD. Another belief is that a child is brought up and taught to have autism, and others believe that dairy and gluten in some diets can cause it. However, these are all misconceptions. Some children that have autism have other conditions. These include Down syndrome, cerebral palsy, Fragile X syndrome and muscular dystrophy, as well as many, many more. Some of the signs and symptoms. Due to lack of interactions and communication and problems with non-verbal and verbal behaviour can be a big sign of autism. Children find it very difficult to interact with others and engage in role play. They use a lot of non-verbal behaviours to express themselves. They have difficulty understanding others, their emotions, their feelings and their points of views. They lack awareness in others and they drift towards children that are older or younger than them, and they often play alone. ASD babies do not often babble and they do not use their vocal sounds. This can cause a delay in their language development. 50% of people with ASD have severe learning difficulties. Some more signs and symptoms. They have trouble with eye contact, reading by facial expressions, understanding body language and gestures. It's hard to understand other people's point of views as they lack the empathy and sympathy of others. Language development, like I said, could be delayed. Children may flap, flick or twist their hands, and this is called a stim, and this is when they're excited or sad. Children often play in a repetitive activity, or they find one subject that they really, really like and they'll use that all the time. Treatments and support strategies. There are no treatments. However, some specialist multidisciplinary agencies can help working together provide beneficial support for the child. These multidisciplinary agencies are the therapists, occupational therapists, speech and language therapists and paediatricians and many, many more. Some intervention styles include imaginative play. This is using toys or role play activities for them. Communication skills, so that using a PEC book or using pictures and signs to communicate with others. Using social interactions, this is group games or peer environments where they can bounce off of each other. And working on academic skills, this is reading, writing and maths. Some more treatments and support strategies. A range of special educational and behavioural programs can help. So the ABA program, for example, is a very intensive course which children are working on a one-to-one basis with an adult, where they're filled with loads and loads of information very, very quickly. Local autism teams must ensure children have a case manager and a key worker. This is to ensure that their EHCPs are all up to standard and that they overlook what is happening with their support. Parents can go on training courses, so there's an Early Birds one in Thurrock, which can teach them a deeper understanding of their own child. Some children may have other problems, so like sleeping problems, aggressive behaviour, depression. These are very common in ASD children, so they may have medication. A local authority can provide some funding towards training or support strategies if these are not available on the NHS. There's some more support strategies and treatments called neurofeedback or hyperbaric oxygen therapy, but these are not recommended. Thank you for listening.